Good afternoon, and thank you for joining us. Today is Tuesday, July 27th, and on today's briefing, we'll hear from Milwaukee County Executive David Crowley, Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Director of Medical Services with the Milwaukee County Office of Emergency Management, and Darren Rausch, Health Officer and Director for the Greenfield Health Department. Thank you all for being here, and County Executive Crowley, we'll start with you today.
Well, thank you so much, Catherine. And today I want to start with the trends that we're seeing about COVID-19, in which is both nationally and locally, we continue to see the case counts rise. And honestly, the pace that we're seeing is quite alarming. And so right here in Milwaukee County, we've seen cases quadruple over the last few weeks as vaccination rates in nearly all demographic groups slowed down. And so the Delta variant is extremely infectious and is spreading quickly throughout our community. In Milwaukee County, we have always required visitors who walk into our buildings to wear a mask in our county facilities. But starting on Monday, August 2nd, we'll be tightening our masking policies internally and requiring all county employees to wear a mask inside our facilities, regardless of their vaccination status. And we know that masks are effective in helping to mitigate the spread of the virus. And we all must do our part to keep our residents as well as our employees and colleagues safe. In our community, as well as our economy, we really can't afford to really take steps backwards. So I want to encourage everyone out there, vaccinated or unvaccinated, if you're going inside of any public building, you should be wearing your mask. And it's an additional layer of protection that's going to keep yourself safe, others safe. So let's do that. But mask is just one part of the equation. We know that the vaccine that is out here is the best tool that we have available in fighting COVID-19. So please, get vaccinated to protect yourself, your unvaccinated child who may be at home, an elderly family member, and an immunocompromised coworker, or whatever your reason, please get vaccinated. And as we're talking about vaccinations, Milwaukee County, we launched a new Vaccinate program to recognize and celebrate employees who have made the decision to receive a COVID-19 vaccination. And so the program is also to encourage those who have not been vaccinated to do their part to protect themselves, their colleagues, as well as their community. So through Vaccinate, fully vaccinated employees will receive up to 8 additional hours of paid time off. Part-time employees will receive 4 hours, and hourly and seasonal employees will receive 2 hours. And to be eligible, employees must submit proof of full vaccination by September 6th. And proof can be a copy of your vaccination card or a screenshot from the Wisconsin Immunization Registry, or a vaccination verification from your healthcare system patient portal. And I'm proud to say that as of today, we've had 1,390 employees submit proof of vaccination to us since the launch of Vaccinate. And we will continue to track the data over the coming weeks, but we're really encouraged by the response that we have seen thus far. Next, I'd like to pivot a little bit to share some updates regarding the $26 billion nationwide tentative settlement agreement relative to the litigation in which Milwaukee County has been involved surrounding the opioid epidemic. And so this week, the Attorney General and local government leaders from all across the country revealed plans to potentially allocate millions of dollars to really help us battle the opioid epidemic. And the announced settlement comes on the heels of Wisconsin adopting the 2021 Wisconsin Act 57, which allocates these settlement proceeds from the opioid litigation between both the state as well as local governments. And I want to give a shout out because I'm extremely thankful for Corporation Counsel Dahl's involvement, as well as the tenacity with which her office has pursued legal as well as legislative help. And so I remain hopeful that we can stem the tide of opioid abuse issues right here in Milwaukee County. And again, this tentative settlement gives me hope. And as we think differently about revenue streams in general, we are starting to look at the county's budget for next year. Milwaukee County, we're going to start to host several open houses the last 2 weeks of August to share information about the 2022 budget and the impacts of COVID-19. And so we are facing about a $21 million budget gap this year. And this is caused large part by the stagnant state revenue. At the same time, the cost of critical services that continues to increase. And so despite our structural deficit and the ongoing impacts of this pandemic, we remain committed to advancing our vision of becoming the healthiest county in Wisconsin by achieving racial equity. And so we will release the dates later this week, but there will be both COVID safe in-person options as well as virtual options for the public to engage with our budget process. So please stay tuned for that information. And with that, I'd like to hand it over to Mayor Barrett. Mayor Barrett.
Thank you very much, Mr. County Executive, and good afternoon, everyone. I think that we're all still riding high on the fabulous performance by the Bucks last week, but there's a little sobering undertone to it. Following the celebration for our Milwaukee Bucks as 2021 NBA champions, we will be closely watching COVID-19 cases for links to these large gatherings. We all know that there were 65,000 people on the plaza last week. We know there were the parades. So a Dear District categorization has been added to the contact tracing process to aid in this effort. COVID-19 infections can take up to 10 days to show symptoms, so the full picture is not yet visible. Of course, our largest concern by far are the people who were unvaccinated, people who went to the parade or went to the celebration or went to the plaza and were vaccinated. We don't feel that that is going to be the problem. Clearly, if people were not vaccinated and they were in close proximity, that is where the problem could occur. And we all know that there's been a lot of conversation about a pandemic among the unvaccinated, because we continue to see a stubborn number of people who are not getting vaccinated. For whatever reason, they're not getting vaccinated. And unfortunately, we've seen time and time again, whether it's recent hospitalizations, whether it's recent deaths, overwhelmingly, the people who are hospitalized are people who are not vaccinated. So the health department will be doing its due diligence to monitor the data, and we'll know more in the coming weeks. We're also working to secure data from the Wisconsin Department of Health Services to get a better picture statewide, as we know there were people from outside the area attending the Bucks celebrations as well. So a lot of excitement, a lot of joy, but a lot of concern at the same time. So let's turn to masking. This is obviously becoming more of a topic nationally. I know a number of cities, New York City, I think, certainly some California cities. We believe here that the best way for us to fight the spread of COVID-19 remains, hands down, more people getting vaccinated. And we keep beating that drum over and over again, and we're going to continue to beat that drum over and over again. I just, in the last 24 hours, was reading about a conservative in the South who made fun of the COVID-19, ended up in the hospital, and now he's become the convert and asking people to get it. So this is what we're seeing over and over again. We want everyone to get the vaccine. They are proven to provide excellent protection against hospitalization and death. But because we are seeing transmission of the virus, even among some vaccinated people, it is increasingly important for everyone to wear a mask in groups and in indoor settings away from home. So I make this recommendation following conversations with Commissioner Johnson of our Milwaukee Health Department and upon guidance from the Centers for Disease Control and Prevention. This request comes without enforcement, and that's the challenge. We are not enforcing it, but we are asking people to wear masks regardless of vaccination status as they go indoors, particularly when they're congregated in a close proximity with other people. This is a tough request to make because we felt like we're getting life back to normal. And we really don't want to use the enforcement because we're not sure that it's going to be effective right now. But we certainly have the hope that Milwaukeeans will embrace masks once more as an effective tool to care for themselves and their community, again, particularly when you are in these close settings. We must come together to beat this. We have seen that we can bring our numbers down when we all work as a team. And I'm asking everyone in this city, everyone in this county, everyone in this region to help us in this effort. So why is this so important? It's important because we have now moved up to the substantial transmission category for COVID-19 cases per 100,000, up to 75.7 cases per 100,000. Our percent positive rate also increased to the moderate transmission category, now significantly lower. So this is a matter for concern for our healthcare experts here at the City of Milwaukee. Our vaccination rates were over 50%, but barely. 50.3% of City of Milwaukee adults, individuals 16 and older, are fully vaccinated. 54.5% of adults have received at least one dose. But as evidenced by this week's metric, discussions about the Delta variant are no longer academic. We are seeing increases in cases and the evidence is empirical. Vaccines, as I've said repeatedly, continue to be the best way to protect yourself and your loved ones from COVID-19. We need to keep vaccinating our community against the disease. And I know that's hard for people to hear. They're tired of it. I'm tired of it. You're tired of it, but we're not out of the woods. And in fact, as we know, and you'll hear more from Dr. Weston and others, this situation is actually getting more serious rather than less serious. And COVID-19 testing remains of the utmost importance to track the level of disease burden in our community. So please keep seeking testing if you are feeling symptomatic or are not vaccinated and have been in contact with confirmed cases of COVID-19. Back to school, let's talk about that. With the new school year right around the corner, the Milwaukee Health Department is preparing for its 20th annual Back to School Health Fairs. These are events that I've attended regularly over the years, and I absolutely love them. The fairs will include school-required vaccinations for children without proof of insurance and COVID-19 vaccinations for anyone 12 or older. Other public health services and information will also be available, and free backpacks and school supplies will be provided while supplies last. Children must be accompanied by a parent or a legal guardian. The dates for these will be this Friday, July 30th at Barack Obama School of Career and Technical Education, located at 5075 North Sherman Boulevard, and Friday, August 6th at Southside Health Center, located at 1639 South 23rd Street. Both events will run from 10 a.m. to 3 p.m. And for more information, you can visit milwaukee.gov/BTSHF. Vaccination clinics. Another way for families to prepare for the coming school year is to stop by one of the Milwaukee Public Schools COVID-19 vaccination clinics this week. Anyone ages 12 and over can walk in. No appointments are needed. Stop by at the Milwaukee Academy of Chinese Language, located at 2430 West Wisconsin Avenue tomorrow, July 28th, or Washington High School of IT, located at 2525 North Sherman Boulevard on Thursday, July 29th, from 9 a.m. till noon. For more information, visit the Milwaukee Public Schools website. Finally, some vaccine and testing clinic updates. Beginning August 2nd, Monday, August 2nd, the hours will change for our free walk-in vaccination clinics at the Northwest Health Center, located at 7630 West Mill Road, and the Southside Health Center, located at 1639 South 23rd Street. The hours will now be Monday and Fridays from 9 a.m. to 3 p.m., Tuesdays and Thursdays from 9 till 6 p.m., and Saturdays from 9 a.m. to 1 p.m. A reminder that no appointment is necessary, no ID or proof of insurance is required, and language interpretation is available upon request. More information on vaccines is available online at milwaukee.gov/COVIDVax or through the hotline at 414-386-6800. And with that, I will turn it over to Dr. Weston. Dr. Weston.
All right, thank you, Mr. Mayor. Good afternoon. First, to our numbers. We are currently seeing in Milwaukee County an average of 84 new cases per day and about 1 death every 3 days. So today, as we see new daily case numbers continue to rise in every state, and as we see more than a tripling of new daily cases over 2 weeks in Wisconsin, and the same in our county, we saw yesterday professional groups representing millions of doctors, nurses, and other health professionals urge vaccination requirements for all healthcare workers. And just moments ago today, we had the CDC recommend that counties with substantial or high transmission resume indoor masking regardless of vaccination status. And that includes Milwaukee County, which has substantial transmission by the CDC's definitions. So the Delta variant has been game-changing in our approach to the pandemic. As a community, as a state, and as a country, we must stay ahead of the curve. We cannot repeat last year, and there are not many places where that is more true than the classroom. So today I wanted to talk about our children. We're quickly approaching the beginning of a new school year. And not only must we remember that we're still unfortunately in a pandemic, but we must not forget about our children. We're in a different time than we were a year ago, when school boards convened medical committees to determine recommendations for safe school environments. It's different in that we have learned and continue to learn much about how this virus affects children. And it's different in that we now have clear and concise guidelines and expert recommendations to follow. On the knowledge front, we have many more studies to inform our understanding of how COVID affects children. We've known since near the beginning of the pandemic that the acute effects on children tend to be minimal. Children are unlikely to get very sick and require hospitalization in the short term. However, we've learned much about the long-term effects of COVID on children, effects that no parent would wish for their child to suffer. And studies are ongoing to determine exactly what portion of children who get COVID suffer these long-term symptoms. But of the studies that have been done, some show that up to 25%, 1 in 4 children infected with COVID may have long-term symptoms. And these include fever, or include fatigue, muscle pain, shortness of breath, and difficulties with concentration. In these studies, often children with long-term symptoms from COVID state that they just don't feel like themselves. Now, until we can offer the vaccine to every child and have each parent comfortable with their knowledge about the safety of the vaccine, we must ensure that our children are protected in the school environment, a place where everyone should feel safe, to prevent both the short-term and the long-term effects of COVID, as well as preventing further spread in the community. So whereas a year ago, the guidelines were sparse for schools and each institution had to cobble together their own set of rules, we now have much more expert consensus and guidelines. So here's what we know from this guidance. First, as much as possible, school should be in person. While there's a place for distance-based virtual learning, in-person education as well as socialization is critical for childhood development. Second, the CDC today and the American Academy of Pediatrics last week, and that's the largest group of pediatric experts in the country, recommends that all staff and students, regardless of vaccination status, wear a mask in school. With the more transmissible and more dangerous variants like the Delta variant, and with the inherent difficulty in determining who is and who is not vaccinated, and with the stigma that comes with an inconsistent masking policy, this is simply the best step moving forward. The downsides of masking are largely theoretical and easily outweighed by the clear health benefits. Additionally, the basic measures of distancing, ventilation, and hand washing remain critical for preventing the spread of disease. And of course, encouraging and making easily available vaccines for teachers, staff, and eligible students is critical to decreasing the ability for the virus to spread. Now, the return to school guidance today is much more clear than it was a year ago. Universal masking in schools and other basic safety measures will be critical leading into this school year. And it's hard to imagine a rationale for going against the guidance from the CDC and the American Academy of Pediatrics in keeping our children healthy. Now, keep in mind, this is not a forever state. Vaccines will become approved for younger and younger children. More and more parents will recognize the safety and the protection that comes with the vaccines. And I'm hopeful that in the not too distant future, we'll see levels of vaccination-induced immunity in schools that we can take off masks and return to normalcy. But we're not there yet. So please follow the guidance, the experts, and the science. We cannot forget about our children. Keep them safe. Thank you very much, and I'll hand it to Health Officer Roush.
Thank you very much, Dr. Weston. It's my pleasure to join today to talk a little bit more about COVID and fill in a little gaps of some of the conversation we've already had today. As you've heard, COVID is still very active in our community and disease rates have climbed pretty significantly over the past month. We know the disease has continued to evolve, and which leads to new variants like the Delta variants, which appear to be more contagious. And we need to really be cognizant of that when we think about our recommendations and we think about some of the personal choices that we're making in our daily lives about masking and vaccination. Again, vaccination remains the most important prevention strategy that we can implement in our fight against COVID. But again, vaccination is not perfect. It's not 100%. And we hear time and time again that cases are occurring in people who are vaccinated, but yet that should not be a reason to not vaccinate. Vaccination rates and successful vaccination that prevents COVID of 85 to 90% is still far better than any set of prevention measures that you can implement as an individual to try to stay away from getting COVID. So please, I would urge all of you to continue to get vaccinated. As we've heard, as we know, cases of COVID are still occurring in our community. And again, the CDC continues to recommend that anyone with signs and symptoms of COVID-19 get tested regardless of vaccination status or prior infection. So that means if you have symptoms, whether they're mild or severe, you should get tested. And just as a reminder, symptoms include fever or chills, cough, shortness of breath, difficulty breathing, fatigue, muscle aches or body aches, and any new loss of taste or smell. And certainly there are many options for getting tested in the community. Your medical provider is one of those options, but there are other testing resources available, including many laboratories that are offering testing in the area. But it's very important, as has been mentioned previously on this briefing, that individuals with symptoms get tested so that we can know the scope of COVID in our community. Now, I also wanted to talk today about the ever-evolving guidance related to COVID, particularly in the schools. And Dr. Weston did a great job of highlighting some of the summary information from the CDC guidance that was just released moments ago. And again, this is guidance that we as health officials in Milwaukee County have tried to share with school leaders in the past as well. And again, the guidance is clearer today than it was a few weeks ago, and certainly clearer than it was a year ago. But we know that masking remains one of those important prevention strategies. And so we certainly hope that school leaders and school boards will continue to evaluate that evolving science and continue to make recommendations that support to the kids in the schools. Particularly of interest to me as a father of an elementary age daughter is the fact that elementary age kids, those under the age of 12, are not eligible yet for vaccination. And so they remain the most vulnerable individuals in our community. So again, masking is a very important strategy to keeping kids safe in schools. Masking is a very important strategy to keep all of us safe, especially if we're in areas or counties with high rates of disease transmission. So with that, I'm going to end my comments because there were so many good comments earlier by others, and open it up for questions so we can answer your questions from the media. Catherine?
Thank you, Director Rausch. We do have several questions in the chat. The first one comes from Derek Rose with WISN 12, and it's for Dr. Weston and Mayor Barrett. He says, what do you say to people who were already vaccine hesitant and remain so after seeing several breakthrough cases where people were vaccinated but still contracted COVID?
So I can start on this one. I think you have to consider the numbers here. So say the vaccines are about maybe 90% effective against the Delta variant, a little more effective against the conventional variant. So you still have that 5, maybe 10% chance of breakthrough cases. So is it possible that you might have a breakthrough case, you might get infected? Certainly. But if you do get infected, you're far less likely to have severe symptoms, you're far less likely to get hospitalized, and you're far less likely to die. And to put a number to it, a person who's vaccinated and gets COVID is about 100 times less likely to die than a person who's unvaccinated. So I would say it's not a disincentive to get vaccinated. In fact, it's an incentive to get vaccinated. We expect a few breakthrough cases, but largely those people have mild symptoms, or in many cases, no symptoms at all.
And I would add that if you look at public health over the last half century, one of the things that saved people's lives more than anything was the use of seatbelts. And we've seen a dramatic drop in the number of people dying in car accidents who wear seatbelts. That doesn't mean that everyone who's wearing a seatbelt is going to survive a horrific accident, but the numbers are certainly in your favor. I use that as just sort of a rough comparison that we have seen some breakthrough cases, but as the doctor said, overwhelmingly, we know that the vaccine has been effective.
Our next question is from Drake Bentley with Milwaukee Journal Sentinel. He says that the state has a call this afternoon regarding the Delta variant. Will the city or county consider a mask mandate if the state does?
I can simply say that if you look at the past, the city has acted more quickly in most instances. I've been in contact with Alderwoman Marina Dmitrievich, who's the chair of the Public Safety and Health Committee here at the city. She's very interested in this issue. She's very outspoken in terms of wanting to have the masks back. I will continue to work with her. I'll continue to work with Commissioner Johnson to see when and if we need to go back to it. Our preference, of course, is that we don't, but I simply cannot rule that out. That is not out of the question. But as I indicated in my comments, enforcement has been an issue. That's why I'm going to continue to talk about how important it is to get vaccinated, because I think that that is by far the least divisive and the most effective way to deal with this pandemic.
And at the county's perspective, again, we've always required visitors coming into any county facilities to continue to wear their mask. And we are tightening restrictions for county employees, whether they're vaccinated or not. So we're going to continue to have our mask restrictions in place for all county facilities.
Our next question is from Mary Jo Ola with Team J4 for Dr. Weston. Regarding the CDC mask guidance, can you explain why even fully vaccinated people should resume masking when indoors?
Sure. So I would say there's really two reasons why fully vaccinated people would want to mask indoors. One is for themselves and one is for everyone around them. So when we think of for themselves, again, the vaccine is not 100% effective. It's extremely effective in preventing disease, and it's even more effective in preventing severe disease and hospitalization. But again, it's not 100%. And so to protect yourself and protect your family, protect, as was said earlier, whether it's your coworker, your child that's unvaccinated, your elderly family member, that's why you want to wear a mask indoors. Now, the other reason is to protect the public. If you get an infection, even if it's a mild infection, and even if you're not going to be hospitalized, you very well may spread that infection to other people in the community and may contribute to the elevated case numbers that we're seeing.
Our next question is from Allison Durr with Milwaukee Journal Sentinel, and she's wondering if we've seen any breakthrough cases in Milwaukee County, and if so, how has that changed over time?
So the number of breakthrough cases is hard to determine, and the reason why is because the numbers that we see for who's vaccinated and the numbers that we see for who have diseases are hard to correlate. Now we can gain a lot from looking at other areas that have done studies, typically academic studies, looking at these and understanding that somewhere between 90 to 99% in most cases of people who become severely ill, become hospitalized, and certainly who die are unvaccinated. Now, as far as whether we have breakthrough cases in Milwaukee, absolutely. I can say anecdotally from working in the emergency department, I see people with breakthrough cases. They tend to be more mild symptoms. They tend to be discharged back home to keep an eye on their symptoms themselves, which is very different from the unvaccinated people I see in the emergency department who have COVID-19.
The next few questions are for Dr. Weston, or I guess the next question. It's from Ben Wagner with WISN 12. He says, the Brewers announced Christian Yelich tested positive for COVID-19. He is vaccinated and was said to be following COVID protocols. What does that say about how transmissible this virus is right now, even in vaccinated people? And do we need stricter measures in place, or is increased vaccination rates the best solution?
Well, so back to the last question, you need look no further than Christian Yelich to answer the question whether there's breakthrough cases. He certainly is an example of a breakthrough case. My understanding is that his symptoms are mild, which again is often not the case with those who've been unvaccinated. So we're lucky to have 3 safe and highly effective vaccines. Now, vaccines that are also effective against the Delta variant. But make no mistake, to answer your question, the Delta variant is extremely contagious. Not only does someone with the Delta variant have more than 1,000 times the amount of virus in their body as compared to the conventional variant we saw a year ago, but it takes less of that virus to transmit disease to others. So you can see why it's so much more easily transmissible person to person with the Delta virus. But vaccines are a layer of protection. They're the strongest layer of protection we have for sure. But in many situations, such as indoors, in public spaces, around others, Especially now, masking and distancing remain critical layers as well to controlling the burden and spread of disease.
Ben's next question is for Mayor Barrett. He says, you mentioned enforced mask mandates at this point may not be effective. Is there a point or threshold in which you may consider reinstituting mask mandates?
Again, I've spoken to the commissioner, I've spoken to Alderwoman Dimitrievich numerous times over just the last couple of days, and we are monitoring this very, very closely. Our concern, of course, is what is the most effective way to fight this pandemic? And I continue to believe that the vaccination is, but that does not mean we are ruling out masks at some point if it's necessary.
Kent Wainscott with WISN 12 said, I know it may be too early to know the full impact of the Deer District crowds on the COVID case numbers, but have you seen any results yet that indicate how much that may have contributed to the increase in cases?
Sure, I can start here. So it is early to see too much correlation between the crowds and the cases. So we'll continue to watch for those sort of relationships and go from there.
Our next question is from Me Wisconsin. The question is, vaccination numbers in minorities continue to be low. Do you have any additional strategies to promote vaccination in these communities?
Well, we've employed many different strategies, whether we're talking about healthy homes for those who can't leave their homes. We talk about door to door, and we continue to do these COVID-19 updates as well. So we continue to talk directly to the community about what needs to happen. But it doesn't mean that we won't come up with more strategies in the future, particularly as we continue to see this Delta variant rearing its ugly head up. And so, I think that, the mayor and many other municipalities, we're going to do everything that we can to continue to promote the vaccinations. We know that there are folks hesitant out there, but we do know that there's a number of people out there that we can still go after and get vaccinated. But I think we all have a part, whether we're elected, community leaders, business leaders, everyone has a part in really talking about the benefits of this vaccine.
And I would concur with that. I was just looking at the list of people who have died from it. And again, there are way too many people of color who have died from this. It is having a very serious impact on our African-American population, on our Hispanic population, to do everything we can. We're doing door-to-door work right now, and we're going to continue to do that. We're going to look for other ways to have incentives and other things to do to make sure that we're addressing this as effectively as we can.
Our next question comes from Hannah Jewell with Fox 6. She says, for those who attended large Bucks celebrations, who do you recommend should be tested? What about those not showing symptoms and or vaccinated?
Well, as with events in the past, anybody who's concerned that they have symptoms or had close contact with someone with symptoms or tested positive or were in a high-risk environment are welcome to certainly get tested and encouraged to do so.
The final question I'm seeing in the chat right now is from Graham Kilmer with Urban Milwaukee, and it says, for Dr. Weston or Director Rausch, could you explain specifically what makes the Delta variant more transmissible? For example, does it produce a greater viral load in an infected person?
That's exactly right. So the viral load in someone with the Delta variant, again, is about 1,000 times. It's actually about 1,200 times what it is in the conventional variant. So if you have COVID today with the Delta variant, you'll have about 1,200 times as much virus in your body as someone did a year ago who was infected with COVID. Now, on top of that, the research is ongoing as to what effect the mutation that caused the Delta variant has, but it seems that it also takes less of that virus to infect you. And so it's easier to attack your cells. It's easier to infect and spread. And so when you have that combination of much more viral load and less actually needed to even spread it, you can imagine it becomes much more transmissible.
Question for the city from Allison Durr. She says, does the city have enough contact tracers to determine how much of an impact the Bucks gatherings could have on case numbers?
I don't have a good answer for that right off the bat, so I will have to check on that.
Thank you, Mayor. Another question here from Mary Jo Ola. What about the Delta viral load in fully vaccinated people?
That's a good question. And that's one of the unknowns, certainly. One would imagine that it's higher than the conventional strain, but far lower than in unvaccinated people. But the science is still out.
Those are all the questions I'm seeing, all really great questions. Thank you all for attending today's briefing. There'll be a few follow-ups following the briefing. Otherwise, we will see you here next week. Thank you all.